everyone. Welcome to our introduction of the Elsa Community Clinical Challenge. My name is Megan, and I am part of the Elsa Health team, and I'm so excited to be with you here today to chat and share a little bit about the Community Challenge that we've recently launched, what it's about, and what we're focused on building here at Elsa Health. So the Clinical Community Challenge is all about building tools for large-scale impact, particularly in healthcare. It's put on by Elsa Health and Inspired Ideas, along with the Tanzania Medical Student Association. Briefly about the agenda today, we're going to talk a little bit about Elsa Health and what we're working on in the world. We'll chat about open health and our open health algorithm platform and how you can use that to help build clinical decision support tools for healthcare. We're going to chat then about the 2022 Clinical Community Challenge, what it is, how you can contribute and get involved if you're interested. And we'll walk through a little bit about the challenge and various resources that you can access. And then finally, we'll talk about support structures and how you can ask for help when you do decide to register for the Community Challenge. So what does Elsa Health do? Elsa Health is an organization that primarily works in East Africa that leverages technology to solve problems in healthcare. And we have a lot of ways that we're focused on doing that, but they're all centered around universal and equitable healthcare for people all over the world. And so there are a number of ways that we make that happen. The first is through building expert-level health AI algorithms. So this is really how can we take expert level decision making, teach that to computers, and then put those computers in the hands of healthcare providers or patients all over the world so that they can make better health decisions. The second part is that we build connected, custom decision support tools so that patients and healthcare providers are able to access the AI algorithms that we build and actually utilize them to improve health outcomes in the community. The third piece we're focused on is research and validation, both of the AI models, but also of broader use of technology, particularly in rural areas or in places where there might not be medical doctors. And the fourth is that we're really focused on community-driven development. And for us, this is about bringing together groups of people, healthcare providers, clinicians, researchers, technologists, policymakers, anyone we can to help build the future of healthcare together. So a little bit about open health and open algorithms, because these terms can kind of be confusing and we want to share about how we're using them. So for us, open health is the collaborative development and practice of healthcare to do a couple of things. The first one is to lower the barrier of accessing healthcare services through innovative approaches. And the second is to democratize the processes and tools that are used to distribute health ownership. So we really want to make sure that healthcare is openly accessible and available to all, and that anyone can both make it and leverage it at any point. So in order to do that, we build open health algorithms. And if algorithms are instructions that encode ideas and best practices, or for example, help someone make a decision about something, then open health algorithms are just simply open sourced or openly accessible algorithms that can be developed by anyone and used by anyone. And that's what our Open Health Algorithms platform is really built around. And we'll be using the Open Health Algorithms platform, which we lovingly call OHAP, and I'll show you a little bit about that platform shortly. But this is where we're creating an ecosystem of, people to be able to really create open health algorithms and have those algorithms be leveraged for impact in other solutions. And OHAP has 5 main objectives, which I'll just go through briefly. The first is to build an international collaborative community of health and technical practitioners. So we want to bring together both the clinical side and the technical side so that we can build healthcare together. The second is to support the development of health algorithms and models. And these can come in a lot of forms, including database models for using things like statistical and machine learning, expert knowledge-based algorithms, which we'll talk a little bit about as well, and where the Clinical Community Challenge comes in. And third is health algorithms or models for benchmarking and performance testing. The third objective is to support efficient and responsible health data distribution and sharing. And we can do this through a number of ways as well, through federated learning solutions, by developing and supporting the use of generative models, and by creating differentially private data sets and generation tools. And all of this can be done inside of the Open Health Algorithms platform. The fourth objective is to support the distribution of health and decision support algorithms. And specifically, this is about being able to utilize and leverage them to actually make an impact in public health and to actually make sure that they get into the hands of those who need them the most. And the fifth is to support the development of health tools that leverage resources by the community. So we build connected tools for healthcare providers and for patients, but we also want to make sure that other people who are building their own tools are able to access and leverage clinical decision support exactly when they need it and exactly where they need it. And the platform enables them to do that. All right, so let's talk a little bit about the Clinical Community Challenge, which is what we're all here for today. So the Clinical Community Challenge is a challenge or a competition to introduce Elsa to the community. And specifically here, we're talking about the clinical or medical community in Tanzania. The competition or the challenge is specifically for clinical year medical students at any medical school across the country. And the purpose of the challenge is to develop algorithms and data sets that can be used globally for improved healthcare. And this will leverage the Open Health Algorithms platform in order to be able to do that. We're launching and starting and running the Clinical Community Challenge because we want to allow the community, all of you, and real users to have a say in the direction of the platform and the tools. So the launching of the Open Health Algorithm platform is new for us, and we're very excited about people being able to use it and leverage it to create real-world solutions, which means that we want to be able to actually build something that's helpful for those users. So any feedback you can give us is, of course, valuable in that regard. We also want to be able to co-develop the technology with future healthcare providers, medical students, all of you, and because we believe challenges are fun. Of course they are, right? All right, how to join and how to participate in the Clinical Community Challenge. Teams will register between 3 and 5 people. So every team gets registered and they have a minimum of 3 people and a maximum of 5. Teams will be assigned to either non-communicable diseases, infectious diseases, or neglected tropical diseases groups. And these are groups that have a set of 25 diseases or conditions within each one that will be assigned to each group for modeling specifically. Teams will develop 25 disease models and 3 vignettes per model. These are clinical case vignettes that will then be used to evaluate and benchmark the models themselves. So again, that's 1 model per disease and 3 clinical case vignettes per model. And we'll look very briefly about what that means in a second when I show you the platform. At the end of the challenge, so on the final day, everything will be locked and submitted. No changes will be allowed to the models or vignettes, and they will enter the review process. So we have a team of experts who will be coming in to review and evaluate both the performance of the models as well as their validity and their effectiveness. We've published a set of criteria so far on the website, so you can feel free to look at that there. And after the review, winners will be announced and awards will be given out. So we are having prizes at the end of the Clinical Community Challenge for the teams who perform the best and who create the best models and algorithms, which we're very excited about. And you can see more about the prizes as well on the website. All right, that was a lot of information. So just to recap, you will register as a team in groups of 3 to 5 students. You'll use the OHAP platform to develop 25 disease models and a total of 75 clinical case vignettes. That's 3 clinical case vignettes per model. And finally, you'll submit your model. The review process will begin. They will be evaluated, and the winners will be announced. The specific timeline for when these things happen is available on the Open Health website as well. And so you can be able to see when registration ends, when the final date is to submit the models, and when the winners will be announced. All right, so let's look briefly at the Open Health algorithm platform. And I will make sure this link is available in the description of this video. So you'll go to this website, open.elsa.health, and this is the beginning part of the Open Health Algorithms platform. This is where you can start to create and register for the Clinical Community Challenge. If you click up here, you'll find some information about the Clinical Community Challenge. This is the website I keep registering, where you can find out more information about what you're working on. You can find out some information about the challenge timeline, and then of course you can register. So it looks like we have a tester account already in here from a previous video that was made, but you can fill out your information here. You will share a little bit about yourself, and then you will create a team, or you will join a team, depending on if you already have a team that's been registered. All right. The other thing I will just show you really quickly, because I've been mentioning it, is the algorithm platform itself. So there are lots of resources, and I'll talk about them in a second, about how to go in, how to create models, how to create clinical case vignettes and everything. But this is just an overview very briefly of models that have been started to be developed already by some healthcare providers. So you'll see those on the platform when you sign in. And if you click into them, you'll start to see some of the information that's shared about how the condition presents and risk factors, etc. Again, this is pretty overwhelming, so please refer to other resources or videos about how to start creating models in order to really understand what's happening here. All right. So again, that's open.elsa.health, and I'll make sure that's available in the description as well. Let's just finish up this. All right, so where, when, and how to get help. Let's assume that you have registered, or you're thinking about registering for the clinical challenge, which we'd love you to, by the way. So what can you do, and how can you ask the questions that you want to ask? The first way to get help is, of course, through your group members. So once you and your group or your team have established themselves, we recommend creating a common communication channel like WhatsApp, or maybe Slack or something, so that you can communicate with each other, especially if something's not clear. Also so that you can divide up the workload and try to better understand who will be working on what. That seems to be very useful, as well as setting up regular co-working sessions. Some of our teams have planned co-working sessions where they get together and they create the models or the clinical case vignettes while they're all sitting and working together. It allows them to be able to do research and really bounce ideas off of each other. The second way you can get help is through resources and documentation. So there's a number of these available, and I will make sure all of these links are also in the description. The first one is the OHAP website I just showed you. Information about the clinical challenge will be updated there, so you'll want to make sure that you're checking that regularly. There are a lot of frequently asked questions on that website. We can actually just go to it really quickly. If you go down here, there's a handful of frequently asked questions about how to use the platform, how to register, those sorts of things. And we will update more questions here as we get them throughout the challenge. You'll also be able to find a set of how-to resources here at the bottom. The second place is YouTube. So I will link our YouTube channel, but if you go to Elsa Health YouTube channel, you'll be able to see a number of videos that talk a little bit about the Clinical Community Challenge, specifically how to register, how to create models, how to create data sets, and clinical case vignettes. And then there's also some other videos about how to think about decision support algorithms and modeling. So these are specifically made for healthcare providers with the intention of not having so much math or not being so math heavy, but really focused on creating models, what it means to think about the distributions and various modeling attributes. So those are all here as well. And then the third place is the Elsa blog, which I'll also just go to. The Elsa blog is a great place for other information about modeling, how we use machine learning for health data, how you might be able to think about probabilities. So if you're having some questions or thoughts about, what modeling looks like or how we're leveraging the probabilities that are being used and researched and shared, please make sure to find that information there. And then, of course, the third way is just through the Elsa Health team. Once you do register, we will send you an email that has information about WhatsApp groups, as well as office hours and how you can directly reach out and contact us if you do have any specific questions. So please make sure that when you register, you use a valid email so that we can share that information with you. We do have a link for joining office hours or signing up for office hours on our Twitter, but I will make sure that's available in the email as well. The best time to be able to do this is really when you have any questions about the platform, you're not sure how to create something. If something doesn't work or it breaks or you want to provide feedback, anything basically that you'd like to talk to us about, we're here to support you throughout the entirety of the challenge. So please make sure that you do let us know. And like I mentioned before, the Open Health algorithm platform is also new for us. And so we're excited to be able to take your feedback and really co-develop this product and platform together. All right. I think that's the end of my slides for today. Thank you so much. Remember, if you'd like to register for the Clinical Community Challenge, you can go here to open.elsa.health. And if you do have any questions, feel free to let us know. Put something in the comments, send us a message on Twitter, whatever you want. We're here to support you. And looking forward to your participation in the challenge.